How are you?
I'm good. How are you?
I'm good. My name is Carolina. I'm your hygienist for today. This is Amanda. She's my associate.
Nice to meet you
And
guys.
today we're going to place a temporary crown, okay?
Okay.
Oh, Grace, I dropped the crown on your mouth. I'm going to have you sit up. And you have to sit up. Don't swallow, please. And just keep coughing to try to expel the crown of your mouth.
Currently, Grace is experiencing partial obstruction of her airway. This can be identified using the universal choking signs such as coughing, wheezing, her hands are on her throat, dyspnea, and/or fear. As long as Grace keeps coughing, this is a good sign.
Yeah, keep coughing. Keep coughing. That's great. Okay, so I'm gonna have you turn back to me. And is it okay if I do some back blows and abdominal thrusts? 2, 3, 4, 5, and then lean forward for me. 1, 2, 3, 4, 5. The crown is not coming out. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
At this point, Grace is no longer able to cough, speak, or breathe, which means the obstruction of her airway went from a partial one to a full one, and at this point, first aid measures are implemented.
The client has gone unconscious. Please grab the AED mask and call 911. I am going to check for her ABCs now.
Grace has now progressed to phase 2 of complete airway obstruction. This usually occurs within the 2 to 5 minute mark. Grace is currently unconscious and has decreased respirations, and blood pressure and heart rate have continued to have gone down. The clinician must start CPR now.
911. What's your emergency?
Hi, we have a patient who's not breathing at our office. We need an ambulance right away.
Okay. And what is the address of the emergency?
It's 201 Wilson Street East in Ancaster.
Okay. And what kind of emergency? How old is the patient? And is the patient breathing?
So we have an 80-year-old patient. She's no longer breathing. She has a complete airway obstruction. She's no longer breathing, and we've begun basic life support and CPR.
Okay. Emergency services have been dispatched. They're 5 minutes off. Please keep doing CPR until the responders arrive.
Okay, thank you. I called EMS. I need you to run to the top of the street to me.
27, 28, 29, 30. Clear. 1, 2, 3, 4, 5. 26, 27, 28, 29, 30. 28, 29, 30.
Always sit down here.
Okay, Grace, I'm gonna have you move it to your side.
When EMS arrives, she checks Grace's vitals. She gets information from both the clinician and assistant, whom provide her information about the medication that Grace has been taking, her vitals, and the amount of rounds it took for CPR. The EMS then takes Grace to the hospital for further workup to see if there's anything still stuck in her airway and for medical clearance.
Hi, I'm EMS. She had an obstruction of the airway with a crown. We did 3 rounds of CPR and we were able to retrieve the crown.
Okay. I'm going to take your vitals.
Okay.
Okay. Yep, that's okay.
So I have a list here of her current medications. I'll leave that with you.
Perfect. Thank you.
Thank you.
Oh, I'm gonna call my client Grace to see how she's doing.
Hello?
Hi Grace, this is Carolina, your dental hygienist. I'm just calling to follow up regarding yesterday. I just want to know how you're doing today.
Well, I ended up going to the hospital and they did a bunch of tests and everything came back okay. So I'm doing well. Thank you for asking.
Okay, that's really good. I'm really glad you're doing okay. And let's get you back for that crown.
Yeah, I'll call next week to book an appointment.
Perfect. See you then. Bye bye.
Okay, bye now.